Most people think high blood pressure happens because they got older, ate something salty, or had a stressful week. And while those things can absolutely matter, they're usually not the deepest answer. Blood pressure doesn't go up because one single thing went wrong. It goes up when the systems that are supposed to control pressure in your body start drifting in the wrong direction together. Your kidneys may be holding on to too much fluid, your blood vessels may be getting stiffer, your nervous system may be running too hot, your hormones may be pushing salt and water retention, and your sleep may be making the whole thing worse without you realizing it. So if you've been told, just cut out salt, or it's only stress, I want to show you why that explanation is often incomplete. Because once you understand the real drivers, fixing blood pressure starts to make a lot more sense. In this video, I want to give you a much better framework for thinking about high blood pressure, not the oversimplified version, and not the version that makes it sound like your body suddenly betrayed you for no reason. I want to walk you through what actually raises blood pressure in the first place, why the same number can come from very different problems in different people, and then how to start fixing the root causes that are actually fixable. We'll talk about the kidneys, your arteries, insulin resistance, sleep apnea, stress hormones, hidden medications, and the very common mistake of treating a number before confirming that the number is even real. And if you value clear, practical health guidance that helps you feel better, please subscribe and join our community here today. Quick note before we dive in, this video is educational, and it's not personal medical advice. High blood pressure treatment should always be individualized, especially if you already take medication, have kidney disease, diabetes, heart disease, or you've ever had a stroke. So please do not stop or change your medications based on a video alone. Use this as a framework to have a smarter conversation with your own clinician. Because the goal here is not to make you afraid of blood pressure. The goal is to make you fluent in it. And once you get fluent in it, a lot of what used to feel random starts to feel much more predictable. So, let's get into it. The first thing we need to do is redefine the question. Most people ask, what causes high blood pressure? As if they're looking for one villain: salt, stress, bad genes, aging. But the better question is, what keeps blood pressure elevated when it should have come back down? Because your blood pressure is supposed to move around. It rises when you exercise. It rises when you're startled. It can even rise when you're talking, when your bladder is full, or when you're late to an appointment. That's normal. The real problem is not a temporary spike. The real problem is when your body starts living at a pressure that is too high, too often, for too long. That's when blood vessels start taking damage. That's when the heart starts pushing against too much resistance. And that's when high blood pressure goes from a number on a screen to a disease process. At the simplest level, blood pressure comes from three big levers. The first is how much blood your heart is pumping, the second is how much resistance your arteries are creating, and the third is how much fluid volume your body is holding on to. So if your heart is pushing hard, or your arteries are tight and stiff, or your body is carrying around extra fluid, your pressure goes up. And in many people, all three are happening at once. That's why hypertension is so common, and also why it can be so frustrating. Because two people can both have a blood pressure of 148/92. But for one person, the main driver may be weight gain and sleep apnea, while for another, it may be stiff arteries and kidney disease. And for someone else, it may be a medication side effect plus stress plus alcohol. Same number, different engine under the hood. And that brings us to what I think is the real cause of high blood pressure in most adults. It is not one food. It is not one bad week. And it's usually not a mysterious curse that fell out of the sky. The real cause is that the systems that regulate pressure stop matching the body's needs. Your kidneys hold on to more sodium and water than they should. Your arteries stop relaxing the way they used to. The lining of your blood vessels becomes less healthy. Your sympathetic nervous system, which is your fight or flight system, stays too activated. Hormones like aldosterone can push fluid retention. Sleep problems can keep adrenaline elevated all night. And over time, the body resets to a higher pressure state. Once that happens, the higher number starts to feel normal to the body, even though it's slowly causing damage. This is also why the statement, salt causes high blood pressure, is both true and not true. It is true in the sense that excess sodium can absolutely push blood pressure higher, especially in people who are salt sensitive. Older adults, people with kidney disease, people with diabetes, and many people with metabolic syndrome tend to be more salt sensitive. But it's not true in the sense that sodium is rarely acting alone. Sodium raises pressure most when the rest of the system is already vulnerable. If your kidneys are slow to get rid of it, if your blood vessels are stiff, if your hormones are pushing retention, if you're eating a lot of ultra-processed food, If you're carrying extra body weight, then salt hits harder. So the salt shaker is not the entire story. The body's handling of salt is the story. And that's a much more useful way to think about it. Now, most high blood pressure falls into what doctors call primary or essential hypertension. That basically means there's not one single disease causing it that we can point to and fix with a neat label. It's usually a blend of genetics, aging, weight, diet quality, sleep, vascular health, stress biology, insulin resistance, and lifestyle patterns over time. But a smaller group of people have secondary hypertension, which means there's a more specific cause underneath it. And this part matters more than most people realize. Because if your blood pressure is being driven by sleep apnea, kidney disease, an adrenal hormone problem, certain medications, alcohol, thyroid issues, or narrowing of the arteries to the kidneys, then just throwing more medication at the number may not be the smartest first move. Sometimes the number improves when you fix the driver. So let's walk through the major root drivers one by one, starting with the kidneys, because this is one of the biggest pieces that people miss. Your kidneys are not just filters, they are also pressure regulators. They help decide how much sodium and water stays in your body and how much leaves. If the kidneys are holding on to too much fluid, then the amount of blood moving through your blood vessels increases. And when you increase the volume inside a closed system, pressure rises. This is why kidney disease and high blood pressure have such a tight relationship. High blood pressure can damage the small blood vessels in the kidneys, and damaged kidneys can then hold on to even more fluid, which drives the pressure even higher. It becomes a loop. So sometimes blood pressure is not mainly a blood vessel problem, it's a fluid handling problem. And once you understand that, a lot of treatment starts to look more logical. When a clinician recommends reducing sodium or uses a diuretic or asks about swelling or checks kidney function, they're not being random. They're trying to understand whether volume is a major driver for you. Some people have a blood pressure problem that is largely a too much pressure in the pipes problem because they are carrying too much fluid. Others have more of a the pipes are too narrow and stiff problem. Many have both. And those people often respond best when we work from both angles at once. This is also why a medication that works beautifully for one person can do very little for another. If the main issue is fluid retention, then a strategy that doesn't address volume may feel surprisingly weak. Matching the treatment to the mechanism matters. Now let's talk about the arteries themselves, because this is the other huge driver. Healthy blood vessels are flexible. They open when they need to, they respond to signals, they cushion the force of the heartbeat. But with aging, inactivity, smoking, poor sleep, chronic inflammation, high blood sugar, and long-standing metabolic dysfunction, the arteries can become stiffer and less responsive. When that happens, the heart has to pump against more resistance every single beat. And over time, that drives systolic pressure up. This is why blood pressure often rises with age, even in people who don't feel particularly different. It's not always because the heart got stronger or because they suddenly started eating badly. Sometimes the problem is that the vascular system gradually lost elasticity. The hose got less flexible. And once the hose stiffens, the pressure reading reflects that. This is one reason I really don't like when blood pressure gets discussed, as if it's just a willpower problem. Because a person can genuinely be trying, genuinely eating better than they used to, genuinely walking more, and still have blood pressure that's high, because decades of vascular change don't reverse overnight. That doesn't mean they failed. It just means the body is dealing with accumulated biology. And that biology can still improve. Blood vessels can function better. Inflammation can improve. Weight loss can help. Physical activity can help. Better sleep can help. Blood sugar control can help. Certain medications can help, but it takes time. So when someone tells me, I've been good for 2 weeks, why isn't my pressure perfect yet? The answer is often that the number you're seeing today is the result of years, not days. And years usually require a more patient kind of repair. There's also a metabolic side to this that deserves a lot more attention. In a lot of adults, especially people with belly weight gain, rising blood sugar, high triglycerides, low HDL, or a history of prediabetes, high blood pressure is often traveling with insulin resistance. And, insulin resistance doesn't just affect blood sugar. It changes how the kidneys handle sodium, it alters hormone signaling, and it often shows up alongside inflammation and vascular dysfunction. So if someone says, I don't understand, my pressure started going up around the same time my weight did and my fasting glucose did, that's not a coincidence. Those things often move together. High blood pressure is frequently part of a bigger metabolic pattern, which means that if all you do is chase the blood pressure without addressing the metabolic health underneath it, you may improve the number but miss the deeper trend. That is why weight loss, when it's needed, can be so powerful. Not because of aesthetics, not because of shame, not because everyone needs to be thin, but because excess body fat, especially around the abdomen, can change blood pressure biology in multiple directions at once. It can increase inflammation, worsen insulin resistance, raise sympathetic nervous system activity, make sleep apnea more likely, and increase the amount of work the heart has to do. Even modest weight loss can make a meaningful difference for some people. And that's important because people often imagine the only way to help blood pressure naturally is with some extreme transformation. Usually it is not. Sometimes what matters is a steady reduction in the things that keep the system under strain. A little less fluid retention, a little better sleep, a little more vascular flexibility, a little lower insulin burden. Those changes add up. Now let's talk about the nervous system, because this is another place where people hear a half-truth and run with it. They'll say, my blood pressure is high because I'm stressed. And stress can absolutely contribute. But the mechanism matters. The problem is not simply that your life feels busy. The problem is when your body spends too much time in a fight or flight state. When stress hormones stay elevated, blood vessels constrict more, heart rate can run higher, sleep gets worse, cravings get worse, and recovery gets worse. And if you stack chronic stress on top of poor sleep, caffeine overuse, alcohol, inactivity, and a body that's already gaining weight, blood pressure has a very easy time drifting up. So yes, stress matters. But the deeper issue is persistent nervous system activation. It's not just an emotion, it's a physiology. And sleep is one of the biggest places this shows up. A lot of people with hard-to-control blood pressure are not just tired, they are under-oxygenated at night. They stop breathing over and over with sleep apnea, even if they have no idea it's happening. Every time oxygen drops, the nervous system gets kicked. Adrenaline rises, blood vessels tighten. The body treats the night like a threat instead of recovery. And if that repeats for hours, night after night, blood pressure can stay elevated during the day too. This is why sleep apnea is such a common hidden driver, especially in people who snore loudly, wake up unrefreshed, have morning headaches, feel sleepy during the day, or need multiple medications and still run high. Sometimes the blood pressure problem is not living in the heart or the diet first. It's living in the bedroom. And to be clear, you do not have to look a certain way to have sleep apnea. It's more common with excess weight, yes, but thin people can have it too. Older adults can have it, women can have it and get missed. People who say, I sleep fine, can still have it. So when blood pressure is stubborn, one of the smartest questions to ask is not, what else can I add? It's, what am I missing? Sleep apnea is one of the big missing pieces. And if it is there, treating it can improve how the whole system behaves, even if it doesn't magically normalize blood pressure on its own. Better oxygen, better sleep quality, lower nighttime surges, better daytime energy, and sometimes lower medication needs. That's not small. That's a root cause intervention, even when it works gradually instead of dramatically. Another major hidden driver is hormones, and the one I especially want you to know about is primary aldosteronism. This is when the adrenal glands make too much aldosterone, a hormone that tells the kidneys to hold on to sodium and water. So what happens? The body retains more fluid, pressure rises, and potassium can fall. And this matters because this condition is often missed. People get labeled as having regular hypertension, but the usual medications don't work that well, or they need more and more medications, or their potassium is low, or the blood pressure seems unusually stubborn. And the frustrating part is that when you identify this cause, there are treatments that specifically target it. In some people, it's treated with specific medications. In others, surgery may even be part of the answer. So this is a perfect example of why the phrase, the real cause, matters. There are clues that should make you think more seriously about a hidden secondary cause. Blood pressure that becomes very hard to control. Blood pressure that starts suddenly and aggressively. Blood pressure that used to respond and now doesn't. Blood pressure with low potassium. Blood pressure in someone who doesn't fit the usual pattern at all. Blood pressure with significant snoring or daytime sleepiness. Blood pressure that showed up alongside kidney problems. And, blood pressure that looks severe despite 3 medications. Those are the situations where it becomes especially important not to assume this is just aging or bad luck. Sometimes the right answer is not another prescription. Sometimes the right answer is more curiosity. We also have to talk about medications and substances because people are often shocked to learn how many things can quietly push blood pressure up. Common decongestants can do it. NSAID pain relievers can do it. Certain antidepressants can do it. Steroids can do it. Hormonal medications can do it. Stimulants can do it. Excess alcohol can do it. Cocaine and methamphetamine can definitely do it. Even a lot of everyday patterns like too much caffeine too close to a reading can temporarily raise the number. This is why blood pressure evaluation should never just be what is the number. It should also be what is entering your system. Because sometimes the blood pressure problem isn't just in the body, it's in the medicine cabinet. And before we jump into fixing blood pressure, there is one step that I think is wildly underappreciated. We have to confirm that the blood pressure is truly high in real life. Not just one bad reading at the doctor's office. Not just one rushed reading with your legs crossed, your arm unsupported, a full bladder, and coffee in your system. Not just one reading while you're talking. Inaccurate measurements are common, and white coat hypertension is real. A surprising number of people have elevated office readings and much better readings outside the clinic. So if someone tells me their blood pressure is high, the very first thing I want to know is how it was measured, how often it has been high, and what their home readings look like over time. Because you do not want to build a treatment plan on a bad measurement. If you're checking at home, the technique matters more than most people realize. Use a validated upper arm cuff, not a finger monitor, and not a random device you found in a drawer from 10 years ago. Sit quietly for 5 minutes. Keep your back supported. Keep both feet flat. Don't cross your legs. Rest your arm at heart level. Put the cuff on bare skin, not over clothing. Don't talk while it's measuring. Avoid exercise, smoking, caffeine, or alcohol in the 30 minutes before you check if you can. Empty your bladder first. Then take at least 2 readings about a minute apart and write them down. One reading is a snapshot. A week or 2 of careful readings gives you a pattern, and patterns are how we make good decisions. This is such an important point because some people are being treated for pressure they don't actually have all day long, while others have the opposite problem. Their office readings look okay, but at home their pressure is high, which is sometimes called masked hypertension. In both situations, the answer is not guessing. The answer is better measurement. Good blood pressure care starts with better data. And if you get a reading that's extremely high, especially over 180 over 120, that's different. That deserves immediate attention, especially if there are symptoms like chest pain, shortness of breath, weakness, vision changes, or trouble speaking. But outside of emergencies, the goal is not to panic over one isolated number. The goal is to understand the trend well enough that you're solving the real problem rather than reacting to noise. So now let's get into the how to fix it part. And I want to frame this the same way I do when I'm thinking through someone in clinic. We are not just trying to force the top number down at any cost. We are trying to reduce the pressure burden in the smartest, safest, most durable way possible. And that usually means working through a sequence. First, confirm the diagnosis carefully. Second, look for hidden drivers that are making the number worse. Third, improve the body systems that regulate pressure. Fluid balance, artery health, metabolic health, sleep, and physical conditioning. Fourth, use medications when needed without treating them like a moral failure. And fifth, know when the pattern suggests you should search for a secondary cause instead of just intensifying routine treatment. That framework keeps you out of a lot of trouble. Let's start with food, because this is one of the most powerful levers, but also one of the most misunderstood. The goal is not to create a weird, joyless, perfect diet. The goal is to build an eating pattern that reduces volume overload, improves vascular function, and supports metabolic health. In practical terms, that usually means moving closer to a DASH-style or Mediterranean-style pattern. More vegetables, more fruit, more beans, more nuts, more whole grains if they work well for you, more fish and lean proteins, more low-fat dairy if you tolerate it, more meals made from actual ingredients, and less ultra-processed food, less restaurant sodium, less sugary drink intake, and less dependence on convenience foods that quietly carry huge amounts of salt. This is not flashy, but it works because it attacks the biology from several angles at once. A lot of the blood pressure benefit people get from eating healthier is not from one magical superfood. It's from changing the overall chemical environment that the blood vessels and kidneys live in. When you eat fewer ultra-processed foods, sodium often falls. When you eat more potassium-rich foods, sodium's effects may be blunted in many people. When fiber goes up, blood sugar control often improves. When you reduce added sugars and overly refined foods, insulin dynamics often improve. When you stop living on packaged food, inflammation often improves too. And all of those changes can help pressure come down. So I would be very cautious about anyone who tries to sell you one supplement, one spice, or one blood pressure hack. High blood pressure usually came from systems. It usually improves through systems. Now, on the sodium question specifically, yes, many people do need to lower sodium. But the smarter strategy is usually not obsessing over the salt you sprinkle on a home-cooked meal. It's identifying the hidden sodium in processed breads, Frozen meals, sauces, soups, restaurant food, deli meats, fast food, snack foods, and packaged healthy items that are doing most of the damage. That's where blood pressure often gets quietly pushed all day long. And if you want to make this practical, one of the easiest first moves is simply reading labels for a week, not forever, just long enough to see where the sodium is actually coming from. Because people are often shocked. They think the culprit is the pinch of salt they add to eggs, when the real culprit is the sandwich, the canned soup, the takeout, and the packaged snacks. At the same time, this is where nuance matters. Some people hear lower sodium and decide they need to eat like a monk immediately. That can backfire, especially if the rest of the diet is still poor. If you're cutting sodium but still living on refined food, sleeping badly, drinking too much, and not moving, you may get some benefit, but you're still leaving a lot on the table. And some people, especially those with certain medical conditions or on certain medications, need more personalized guidance. So the better message is this: improve the whole dietary pattern, then adjust sodium within that pattern. That's usually more sustainable, and it usually targets the real driver more effectively than one rigid rule by itself. Potassium is the other half of this conversation that people forget. In many people, potassium-rich foods help the body balance sodium better and support healthier blood pressure regulation. Foods like beans, lentils, potatoes, yogurt, leafy greens, squash, avocado, and fruit can all contribute. But this is where I need to be careful, because more potassium is not right for everyone. If you have kidney disease, or you're on certain medications, or you've ever been told your potassium runs high, that advice can be wrong for you. So this is a perfect example of why high blood pressure treatment always has to be individualized. The principle is solid. The application depends on the person. Exercise is another place where the root cause story gets much better than the usual cliches. People are often told, exercise because it's good for blood pressure, which is true, but vague. The reason it helps is that movement improves vascular function, supports weight regulation, lowers insulin resistance, improves sleep, reduces stress load, and can make the nervous system less reactive over time. And that's a big deal, because remember, high blood pressure is often the result of multiple small systems pushing in the wrong direction. Regular movement pushes several of them back the other way. You do not need a heroic workout plan to benefit. Walking matters, cycling matters, swimming matters, resistance training matters. Consistency matters more than intensity for most people. Now let's come back to weight, because this is one of the most effective but emotionally loaded topics in medicine. Excess weight does increase the likelihood of high blood pressure, but that does not mean blood pressure is a character flaw or that every person with high blood pressure simply needs more discipline. What it means is that body weight can amplify several blood pressure pathways at once. More fluid retention, more insulin resistance, more sleep apnea, more inflammation, more sympathetic nervous system activity. So when weight comes down in a sustainable way, pressure often becomes easier to control. And sometimes it becomes dramatically easier. But sustainable is the key word. Crash dieting, punishing routines, and shame-based plans usually don't hold. Blood pressure is better served by consistency than by intensity here too. Different blood pressure medications work on different parts of the system. Some help the body get rid of extra fluid. Some relax blood vessels. Some block hormone pathways that keep vessels tight or tell the kidneys to hold on to sodium. Some slow the heart. And because people arrive at high blood pressure through different combinations of mechanisms, it makes sense that they respond differently. A person with major volume issues may benefit a lot from one class, while a person with another pattern may need a different approach. This is why good blood pressure treatment isn't just about memorizing drug names. It's about asking, what problem is this medication trying to solve in this particular body? Because here's the good news. High blood pressure is one of the most common problems in medicine, but it is also one of the most modifiable. Not always instantly, not always with one change, and not always without medication, but modifiable. Absolutely. The body is responsive. Blood vessels respond, kidneys respond, weight loss helps, sleep helps, better measurement helps. Better questions help. And even when you can't erase every contributor, you can often lower the total pressure burden in a very meaningful way. That matters. It matters for the heart, for the brain, for the kidneys, for stroke risk, for energy, and for how well you age. So if you've been feeling overwhelmed by your blood pressure, I want you to take one thing from this video. Don't reduce the story to salt or stress or bad genes. Your blood pressure is telling you something more detailed than that. Listen closely enough, and the fix usually becomes clearer. Start with accurate numbers, then follow the physiology. That's where the answers are. And That's where real progress usually starts. I hope this was helpful. Take care of yourself, keep asking better questions, and I'll see you in the next one.